Welcome to the NNLM Virtual Symposium. This session is on health misinformation, and our speakers for today is Xiaoli Nan, Kathryn, Thier, and Wang. And we're going to explore the history, the research, and solutions, and talk a little bit more about health misinformation. Just a few housekeeping rules. If you would use the chat for your comments, you will select everyone when posting questions and comments to the chat. You will submit your questions for the presenters using Q&A. Closed captioning is available, and the hashtag is hashtag health misinfo NNLM. Now, this presentation is being put on by the National Institutes of Health, who is the nation's research agency with 27 institutes and offices, the National Library of Medicine, NLM, the world's largest biomedical library, the network of the National Library of Medicine. The core of NLM's outreach program is to reduce health disparities and improve health information literacy, and the regional medical libraries, the RMLs, offices, and centers, and they coordinate the operations of the network of libraries and other organizations to carry out regional and national programs. So at this point, we're going to turn it over. The topic for today is, hold on, health misinformation, what it is, why people believe it, and how to fight it. So we're going to turn it over to our speakers, and they will start to share their screen.
Okay. Can everyone see the presentation? Okay. Great.
Yes.
Great. Okay. Thank you very much for organizing this very interesting and important symposium. And I'm Xiaoli Nan. I am a professor of communication science at the University of Maryland. And I'm really excited to be here today with two of my outstanding PhD students, Kathryn Thier and Yuan Wang, to share our thoughts on health misinformation and some of the recent work we did in this important area of research. So in our talk today, we'll address three fundamental questions about health misinformation: what it is, why people believe it, and how to counter it. So we slightly changed the wording of our title from fight it to counter it. There was a backstory to this. I can tell this later if you guys are interested. But overall, the idea is that let's not take too much of a combative kind of attitude toward this. It's a problem to be solved, but there's no need to be super combative about it. So I think it's a good advice. So we took it. We changed our title to how to counter it instead of how to fight it. So this is what we're going to do today in this session. So Yuan's going to take up the first question, and she's going to provide an overview of the challenges in defining health misinformation. And she will introduce a tentative definition to sort of stimulate future research. And Kathryn will follow up to review some of the theoretical and empirical work we did recently that can help us understand or make sense of the reasons why people believe health misinformation. And finally, I will discuss how we might counter health misinformation systematically based on a deepened understanding of the psychology of health misinformation and the broader health information ecosystem. So as you can see, our scope is very big here, and we're being very ambitious. I will try to cover the three topics, with enough depth to stimulate further conversations about this super important topic. So with that, I'm gonna give it hand it over to Yuan to talk about the definition all health misinformation, what it is exactly.
Hello everyone, I am Yuan, and I will first talk about what is health misinformation. So despite the growing amount of research out there, there is actually a lot of disagreement on how to define health misinformation. In our scoping review about health misinformation definitions, we found over 30 different definitions of health misinformation or misinformation. And the problem is, without a clear definition, it will be difficult to compare research, evaluate the impact of misinformation, and design effective interventions. So today we want to first dive into some important questions about defining health misinformation. Like, shall we differentiate between misinformation from disinformation in a definition? Shall we distinguish misinformation from misperception? What benchmarks should be used to define misinformation? Are inaccurate and unsubstantiated claims a form of misinformation? And how shall we differentiate health misinformation from other forms of misinformation? Some definitions differentiated between misinformation and disinformation based on the sender's intention to deceive. For example, according to the definitions proposed by CDC, misinformation refers to false information shared by people who do not intend to mislead others, while disinformation refers to false information deliberately created and disseminated with malicious intent. So while the conceptual difference between misinformation and disinformation is clear, in practice, it can be challenging to determine the intention behind false information. So false information can be intentionally created with the aim to deceive, but it can also be shared unintentionally. And also, false information can mislead people regardless of the source's intention. So therefore, we believe distinguishing misinformation and disinformation may not be helpful in practical terms. Instead, we suggest defining health misinformation as an umbrella term that includes false information created or shared with or without the intention to harm. Some definitions of misinformation rely on how recipients perceive false information. For example, one definition proposed misinformation is not merely false and inaccurate messages. False and inaccurate data constitute misinformation only if the recipient judges it to be useful. Similarly, another definition defines misinformation as information that people accept as true despite it being false. By these definitions, misinformation refers to false messages that lead to misperceptions. However, this approach has its limitations, since misinformation and misperception are conceptually distinct. A piece of misinformation may lead to misperceptions among some people, but not others. Also, whether people accept false information does not change its nature. Defining misinformation based on its intrinsic features, rather than how people perceive it, can help distinguish misinformation from facts and systematically evaluate the impact of different types of misinformation. Another point of debate on the defining feature of health misinformation is what benchmarks should be used to evaluate falsehood. One common benchmark is agreement among the majority of specialists on studying a particular phenomenon. However, expert consensus is not always available, especially for emerging or contentious health issues. In such cases, the best available evidence should be used as an additional criterion to distinguish misinformation from facts. So, how to determine the best available evidence? The evidence pyramid provides a useful guideline. According to the evidence pyramid, medical studies can be ranked into a pyramid based on the quality and reliability of their designs. The higher the position on the pyramid, the stronger the evidence. In general, systematic reviews and meta-analysis are considered as the strongest evidence, followed by randomized controlled trials, cohort studies, cross-sectional studies, case studies, case reports, and expert opinions. Misinformation should be evaluated for accuracy against the best available evidence at the highest level in the evidence pyramid. So by this approach, information initially considered as misinformation may become accurate as higher levels of evidence emerge. Moreover, information inconsistent with lower levels of evidence, such as expert opinion or case studies, may be a form of misinformation. But this should be considered with less confidence than information contradicted with higher levels of evidence. There is also debate about whether unsubstantiated and inaccurate information, along with false information, should be considered as misinformation. Some people argue only false claims that directly contradict expert consensus with the best available evidence should be considered as misinformation, while another approach supports a broader definition that includes all three types of claims. We believe that including unsubstantiated and inaccurate claims in the definition of health information is important because, first, health claims that lack evidence could also be harmful, just as those that are proven to be false. In addition, in the real world, misinformation is often misleading or unsubstantiated rather than clearly false. Therefore, we argue for a more inclusive definition of health misinformation that includes false, inaccurate, and unsubstantiated claims. This approach is necessary to capture the full range of misinformation present in the current information environment. Finally, a clear definition of health misinformation is to define not only misinformation, but also health. Most current definitions of health misinformation often use the term health-related claim without explicitly acknowledging the health aspect. We propose categorizing health misinformation into two groups: misinformation about health promotion and misinformation about disease control. Disease control-related misinformation can occur at any stage of the disease, including etiology, prevention, detection, diagnosis, treatment, and survivorship. For example, a claim that vitamin and mineral supplements can cure COVID-19 is false information about disease treatment and is considered health misinformation. While on the other hand, a false statement like the government fakes evidence related to COVID-19 pandemic is not health misinformation because it does not pertain to health promotion or disease control. Based on these points, we propose a unified definition of health misinformation. Health misinformation is a claim of fact about health promotion and or disease control that is currently false due to its contradiction to expert consensus and all best available evidence at the time, inaccurate due to its use of incomplete evidence, or unsubstantiated due to a lack of evidence. So this is just a working definition, and we would love to hear your feedback and suggestions. And in the next page of our presentation, my colleague Kathryn will discuss why people believe in health misinformation.
Thank you, Yuan. So as she said, we are now going to turn to what makes people susceptible to health misinformation. And we argue that susceptibility to health misinformation is driven by multiple psychological processes. And based on the research available, we developed a theory-based framework to try to make sense of the varying reasons why people believe health misinformation. And we came up with these 4 categories that are centered on how people reason and process information when they receive it. So first, I'd like to talk about ability to reason accurately. When people have the ability to reason accurately, they are less likely to be susceptible to health misinformation because they are processing that information with logical arguments and relying on their knowledge and rational thought. But by contrast, when people are motivated by directionally motivated reasoning, they are more susceptible to health misinformation because they're not guided by those accuracy concerns. They tend to accept misinformation or any information really as true when it is aligned with the beliefs that they already hold. Moving to the top right-hand portion, we also consider the idea of accuracy-motivated reasoning versus intuitive thinking. So accuracy-motivated reasoning is just what it sounds like, people motivated by accuracy, whereas intuitive thinking is when you hear people say, like, I trust my gut, that intuitive, quick response that isn't guided by accuracy. And people who rely more on intuitive thinking are less able to discern truth from falsehood. Finally, in the bottom right, we have identity-motivated reasoning. And this is when people rely on aspects of their identity, be it their gender, their political leanings, their racial or ethnic or national identity. And when people rely on those identity factors, they are more susceptible to health misinformation because, again, they're not motivated by accuracy. So, for instance, information that is approved by their group or their group leaders is more likely to be accepted as true, regardless of its accuracy. So in another study, we undertook a systematic review of the empirical literature, where we looked at 47 publications, which included 61 empirical studies. And we looked for evidence of individual differences in psychological traits that are associated with susceptibility to misinformation. And what we found is that, broadly speaking, subject knowledge, literacy and numeracy, analytical thinking in comparison to intuitive thinking, and trust in science confer very strong resistance to health misinformation. If you look down at conspiracy thinking, religiosity, conservative ideology, conservative party identification, those are more associated with susceptibility to health misinformation. And of course, in some cases, we found less clear or more mixed findings. So next, we took those 22 individual traits that we identified, and we classified them based on the psychological predictors from our integrative model. And as you can see, things like knowledge and skills, which some of the examples, again, are subject knowledge, numeracy, literacy, all relate to one's ability to reason accurately. And so, again, this helps establish evidence for our claim that the ability to reason accurately is largely protective against susceptibility to health misinformation. Thinking style, when you have a more analytical thinking style, that's a more accuracy-motivated reasoning. But intuitive thinking style might be categorized by something like conspiracy thinking. And in that case, that would provide less protectiveness against health misinformation. Group identity, some of the things that I mentioned before, political party affiliation, national identification, those map onto identity motivated reasoning. And trust is very interesting. So I'd like to point out a little bit about trust because it's a type of intuitive reasoning, but sometimes trust is actually helpful in guarding against health misinformation, and sometimes it's not. So for instance, we found that trust in science confers very strong resistance to health misinformation. In that case, you're using your trust in science or scientists as a heuristic, which allows you to just quickly accept the truth of something. But on the other hand, trust in healthcare professionals, which you might think would guard against susceptibility to misinformation, really played a weak role in the association with susceptibility to health misinformation. And lastly, trust in journalists actually appears to increase one's susceptibility to health misinformation. And we think maybe this is because news reports are often a source of health misinformation. So again, the same type of big category trust can work in different ways when it comes to being either protective or not protective in terms of one's susceptibility to health misinformation. So far, we've been talking about traits, which are more dispositional, but people also experience states when they encounter misinformation or any information, really. They experience a momentary or on-the-spot reaction, and those types of reactions can also influence how they process health misinformation. So in a study that we have that we're working on that's in progress right now, we created a more comprehensive psychological model of health misinformation that really combines both the psychological traits as well as the psychological states. And as you can see, each of these work through these different psychological processes, this ability to reason accurately, motivation to reason accurately, directionally motivated reasoning, and identity motivated reasoning. So research shows that there are 3 psychological states that appear to be very important in facilitating misinformation acceptance. So the first is a feeling of fluency. And the idea behind that is that people basically make a snap judgment or have an overall feeling of fluency, where if information is easier to process, it's related as more believable than information that is more hard to process. And as we know, sometimes scientific or health misinformation can be harder to process. And so that feeling of fluency is really key in possibly increasing people's susceptibility to health misinformation. The next important psychological state is emotional response. So when we were talking about trait emotions, those were things like anxiety or worry about a health issue. But these state responses are more like when you have a response induced by the information itself. Like maybe you're exposed to a piece of information and it makes you surprised or angry or happy or sad. Whatever it is, emotional responses are associated with worse truth discernment and the ability to distinguish true from false headlines. And this is really critical because, especially in the context of vaccine misinformation, research shows that the vast majority of anti-vaccination websites do utilize emotional appeals, which makes people thus more susceptible to that misinformation. And lastly, source perceptions. So source perceptions contribute to misinformation acceptance because people make judgments when they view or process information about whether the source is trustworthy, whether the source has expertise, whether the source is aligned with their political beliefs or not. And, again, this can work in a positive way, but the idea is that source perceptions are a strong heuristic that people use to decide whether information is valid or not, regardless of the information's actual validity. So to sum it up, just as psychological traits can predispose individuals to becoming more susceptible to health misinformation, so can psychological states. And both of these big picture factors work through these multiple psychological processes, which are defined by people's ability and motivation to reason and process information. And now that we've talked about who is more susceptible to health misinformation, I'll turn it over to Dr. Nan to discuss what we can do about it.
Thank you, Kathryn. That was wonderful. So hopefully we now have a better understanding of what health misinformation is and why people believe it. Now, let me talk a little bit about how we might counter health misinformation. So when it comes to the threat of health misinformation, our sort of instinctive response is to fight it directly, right? But here we would argue that fighting misinformation directly and alone is not going to be sufficient to address this huge problem. What we need to do at the same time is to work to promote and elevate reliable health information as well. So in a working paper, we developed this accessibility acceptance framework to outline sort of a systematic approach to countering health misinformation. So in this framework, we propose that countering health misinformation must start with reducing the accessibility of misinformation while simultaneously increasing the accessibility of reliable information. Now, moreover, countering health misinformation will necessitate interventions that reduce individual susceptibility to misinformation and those that increase acceptance of reliable information. So it's like we have to fight this on two fronts. One is dealing with misinformation. The other is we need to do something about reliable information as well. So next, I'm going to briefly talk about each component of this accessibility acceptance framework. So first of all, the accessibility component really suggests that we need to do two things. One is to decrease accessibility of misinformation, and then at the same time, increase accessibility of reliable information. In terms of decreasing the accessibility of health misinformation, there are many potentially effective approaches. So we now know from some recent investigation that a small subset of users are responsible for spreading most misinformation online, including most health misinformation, like vaccine misinformation and other, fake health news. And then social media companies have really taken steps to remove user accounts that are super spreaders of misinformation. So long-term, consistent implementation of these measures, along with optimized algorithmic content moderation. So you try to, make certain content more visible to users and certain content kind of, down-ranked, so to speak. And doing that will likely reduce the prevalence of health misinformation online substantially. That should be a very effective measure. And then on the other hand, interventions can also be designed to decrease the general public's tendency to share misinformation online. Right. So there are social media prompts that can increase frictions for sharing misinformation. So that would actually reduce the speed at which misinformation travels online. So for example, on Twitter, when users are about to share a piece of misinformation, Twitter would send the user a prompt with additional context and ask, are you sure you want to share this? right? So that creates a friction to share misinformation. And then there's this pretty popular techniques, at least in academic circle, they're called accuracy nudges, which basically ask people to rate the accuracy of like random news headlines. And that can presumably increase the salience of accuracy goals, and as a result can reduce misinformation sharing. And then finally, we can develop interventions to disincentivize misinformation sharing. So we now know from research that a strong driver of misinformation sharing is really the motivation to gain social engagement, like getting more likes, on your post, or getting more comments. So creating an incentive structure where misinformation does not attract social engagement. So for instance, removing bots that specifically like posts with misinformation, or disallowing misinformation to be liked in some way, could potentially reduce misinformation sharing. And then we could also develop an incentive structure where misinformation sharing is socially penalized, right? For instance, we can add a distrust button that would allow viewers to react negatively to questionable posts, right? So that kind of penalize misinformation online. So this could be similarly effective in reducing misinformation sharing. Now, on the other hand, in terms of increasing accessibility of reliable health information, there are a lot of things we can do, and we've been doing those things actually for some time, but I think we can do it better. So the first is like on social media, in an online environment, we can try to boost reliable information, right? So now since the COVID-19 pandemic, and there are some social media companies have been taking steps to connect people to accurate information. Like in 2022, Google launched the helpful content update and applied the updated algorithm site-wide to give quality content better ranks in search results. And similarly, Meta created a COVID-19 information center, which is featured at the top of newsfeed on Facebook to uplift facts about COVID-19 from trustworthy sources. So those should be really powerful, very effective measure in terms of amplifying reliable information. And then scientists and health professionals can help with promoting the visibility of reliable information, perhaps by building more dialogues with the public on social media and other accessible communication channels. Social media could enable experts to engage the public in interactive ways. So for example, the WHO developed a Facebook chatbot with which people can ask their personal questions and then received like really individualized personalized responses about COVID-19 from the WHO. And then we can also, we want to disincentivize the sharing of misinformation, right? But at the same time, we should also try to incentivize the sharing of reliable information. So there's studies that have actually found that just providing small financial incentives can actually encourage sharing of accurate information. So potentially government and health organization could, use this approach, and maybe based on a cost-benefit analysis and using financial incentives. Social media platforms can encourage sharing of reliable information by building a culture of fact-checking or other incentive structure. For example, the platforms can develop a system to socially reward sharing of reliable health information. So opposite to the distrust button, we can, add a trust button that allows viewers to react positively to posts with quality information. Okay, sorry, I was interrupted by my by my kids. All right, so finally, in terms of increasing accessibility or reliable information, well, we could integrate health information into news and entertainment and media, and we've done that, but I think we should do a better job of connecting health professionals with journalists and entertainment program producers to write more engaging stories, but also that disseminate reliable health information. So moving on to the acceptance component of the framework. So we first need to develop interventions to decrease the public susceptibility or acceptance of health misinformation, empowering individuals to reject misinformation and become more discerning of scientific versus unreliable information. So our main point is that depending on which psychological processes are at work, interventions should be designed accordingly. So if limited ability to reason accurately is a driving factor for accepting misinformation, then we can use education, literacy training, or pre-bunking or fact-checking or correction techniques should all work very well. But if limited motivation to reason accurately is to blame, then accuracy nudges can be an effective way of reducing susceptibility to misinformation. We could also seek to increase public trust in sources that typically provide reliable information, in a way to leverage the benefit of intuitive thinking, right? So greater trust in science in general is strongly associated with less susceptibility to health misinformation. Following the I trust the science heuristic should in general lead to a more informed public. There's certainly there counter story to that, but we can talk about that if we have time. And then susceptibility to health misinformation, if it is driven by directionally motivated reasoning, in which people accept false claims that are consistent with their prior beliefs, values, or worldviews, and reject those that are inconsistent, then those sort of traditional methods like fact-checking or direct correction may not work very well. And instead, what we should try to do is try to frame our correction messages in ways that are consistent with the audience members' beliefs, values, and worldviews to increase the efficacy of those interventions. And then finally, when beliefs in health misinformation result from an attempt to protect one's personal or group identity, then efforts to reduce susceptibility to misinformation should shift accordingly from focusing on the misinformation beliefs to the identities that underlie these beliefs. So possible interventions would include value affirmation, which is basically a technique that can reduce perceived threat to self-identity, or we can use normative messages, focusing on the normative trends, what other people are thinking and doing, or we can use in-group messengers to deliver corrective information. Now, an indirect but important way to counter health misinformation is to make reliable health information more convincing and persuasive. In general, effective interventions for decreasing susceptibility to health misinformation should simultaneously work to increase overall acceptance of reliable information, and then additionally, based on our understanding of the psychological traits that Kathryn earlier explained that predispose acceptance of information, there are specific strategies at the messaging level that we can adopt to increase acceptance of reliable information. So basically, there are three psychological states that are really crucial here, right? So the feeling of fluency, emotional responses, and source perceptions. So instead of simply presenting scientific facts, we need to design strategic science communication that leverages these psychological states to increase the probability that reliable information will be processed and accepted rather than avoided, disregarded, or questioned. So first, to increase acceptance of reliable information, such information needs to be presented in a way that are conducive to a subjective feeling of fluency, which can be enhanced basically by familiarity, like just through sheer repetition, or any feature of the information that renders it easy to process. So for example, we can use repetition, visual aids, and narratives, or reframes the information in line with the message recipient's prior beliefs to increase perceived fluency. Okay, and then emotions can also be harnessed to increase acceptance of reliable information, but it needs to be done in a careful way. So for example, health messages that induce fear, guilt, hope, or compassion in general increase compliance with the recommendation in that message. But information that induces despair and shame as part of the guilt or fear message can have the opposite effect. So we need to do this kind of in a careful way when utilize emotions. And finally, to increase acceptance of reliable information, such information should be associated with sources that are perceived as credible, either high expertise or trustworthiness. But through research we found, review of the literature, we found that, mostly what really matters is trustworthiness, not so much about expertise. So we should try to associate reliable health information with a trustworthy source, and more so than just an expert, right? Like a scientist, with high expertise. But instead, I think the communicator should be very trustworthy in this sense. So what are some of the trustworthy sources? Mostly they are in-group messengers. They are considered very trustworthy. And messengers who share your values and worldviews are perceived as more trustworthy. And then those that don't share these beliefs. So identifying and utilizing in-group messengers and trusted influencers that share the public's values and worldviews really present a lot of challenges, but also opportunities for health and science communicators. So putting all this together, this is like the full picture of the accessibility acceptance framework, which really outlines a multi-pronged approach to countering health misinformation or misinformation in general. You can find this model in one of our working papers. So in conclusion, so there are a number of really important issues about health misinformation that researchers or practitioners really need to attend to as we tackle this gigantic societal problem. So first of all, to systematically tackle health misinformation, we need to come to an agreement as to what constitutes health misinformation. So defining health misinformation is really challenging, as Yuan talked about earlier, given the inherent ambiguity of the notion of health and perhaps more crucially, the fuzzy boundaries for misinformation. But minimally, we believe that we need to highlight the sort of the paradigm domains of health problems, which include health promotion and disease control, and then be very explicit about the benchmarks we use to kind of judge all information, when we evaluate these information for veracity, and acknowledge what kind of benchmarks we're using, and also the time-bounded nature of such benchmarks. So it's, like today's truth is tomorrow's falsehood. So we know that these benchmarks there's some certain fluidity associated with it. And then we need to distinguish between misinformation and misperception. One is about the information itself, and the other is about how people perceive it. And these are two different things. We need to distinguish these two concepts. And then we really need to de-emphasize the role of intentionality, because in practice, there's no way we can, most people cannot tell the intention behind a message. And the intentional message really doesn't have any bearing on its potential impact. And then we need to consider a wide variety of misinformation forms or types, like including false misinformation, inaccurate information, and unsubstantiated claims or unsubstantiated information. Now, second, this is maybe a little bit surprising to this audience, but I think we believe that acknowledging that health misinformation is an urgent problem is necessary. Although we're all very concerned about this problem, there's a lot of response from the government and all sectors, but there's still debate going on about whether we should be tackling this issue at all. There are some researchers who have questioned really the utility of countering misinformation. And some of the arguments are like, consumption of misinformation is very low as compared to consumption of reliable information. And then also the idea that, misinformation has no real world consequences other than impacting beliefs, and misinformation doesn't impact behavior. So those are, arguments we should look at and analyze, but not everyone's on the same page about what we should do about misinformation. So we need to come to the realization or some sort of agreement that, okay, this is a problem and we need to attend to it. And then third, so it's obviously a complex problem, and then the solution needs to be multi-pronged, multi-layered, and carefully calibrated based on an understanding of the root causes of the problem. So there's no silver bullet in some way, it has to be, multi-layered approach that look at both misinformation and reliable information, and looking at both accessibility and acceptance. So this is, essentially the thesis of our accessibility acceptance framework. We need to fight on two fronts, the supply side and the demand side. So countering health misinformation on the supply side means really decreasing the accessibility of misinformation while increasing accessibility of reliable information. And then countering misinformation on the demand side means reduce susceptibility to misinformation by increased acceptance of reliable information. So there are many, as I just talked about, there are many ways or strategies we can, harness or use to increase acceptance of reliable health information. And then ultimately, I think our ability to counter misinformation really hinges on a shared understanding of truth. And in a society where people disagree on objective truth or ways to settle truth, correcting misinformation may be seen as sort of a righteous cause by some, but maybe a tyrannical kind of overstep by others. So improving and optimizing the truth-seeking, a reality-based community, which are basically academia, mainstream journalism, parts of government agencies that curate data and evidence and law. These institutions, really, we need to strengthen and optimize these institutions. It's really critical to the fight against misinformation. And similarly, we need to build trust, public trust in this institution, which really requires these institutions uphold truth-seeking principles, and then improving their transparency in their public communication, which could potentially lead to more public trust. But it all comes down, I think, to enhancing and building public trust in these scientific institutions, which can be really, really challenging. Okay, so I'm going to stop here. So there are a bunch of papers, publications, and working papers that that informed our presentation today, and we're happy to share any of those with the audience members. And feel free to reach out to any of us if you have any questions or need any additional information. So I'm going to stop sharing. I don't know if we have Q&A or how do we handle the rest of the time.
We do have
to
time
answer
for
any
Q&A.
questions.
We do have time for Q&A. And there were some questions that were in the Q&A section. I think they have been answered. But one question I had was, in the day-to-day health sciences environment, we are a trusted source of information. So how do we now kind of embrace the scientific community to help them to become more trusted? What kinds of things can we do to help them to become a trusted source? Because they do see us as a trusted source in libraries.
Yeah. I mean, so I think, maybe Kathryn and Yuan can chime in too. I think building trust is such a long-term kind of endeavor. But I think we shouldn't lose perspective here. I think in general, scientific institutions are still very much trusted. And the vast majority of Americans, I think we're only talking about American here. I think there's different story globally, but most people still trust scientific institutions, those sort of reality-based communities. But I think our focus would be on maybe segments of the populations that have grown less trustful of these institutions. And particularly in recent years and since the pandemic, and there is a really sharp decline in trust in these institutions among, individuals with certain political affiliations or certain ideologies. So I think always trying to understand the people we are communicating to and where they are coming from and why they're not trusting scientific sources, and understanding, like the framework we're building in understanding the psychological causes of distrust would then inform better strategies to build back trust in some way.
I can read a couple questions to you from the chat, so you don't have to try to look through them. One of the questions we got was, how would you address the complaint of censorship if systems decrease accessibility of misinformation?
That's such a good question. Kathryn used to be a journalist. Do you have any thoughts about that? Yeah, I mean, accessibility is an essential component of our model, and I think it's essential to control the accessibility of misinformation. And there is definitely this balance between free speech and also, reduce the spread of misinformation. I don't know. I mean, it gets really complicated. But I want to give my colleague a chance to respond as well.
Yeah, I mean, it's a great question. And I mean, I think one of the key things to remember is that, the First Amendment doesn't apply in the same way to companies. And by that, I mean, if a company decides to censor or not put out certain information, they're not actually violating the First Amendment or free speech. It's when the government tries to censor people. So I think, while I think there will be complaints if social media companies do increase the ways that they're putting out information, it really actually, at the end of the day, isn't a censorship issue. It's only a censorship issue if the government tries to prohibit free speech. And I think that point needs to be raised more in this discussion.
That's a great point.
There's another question that says, are journals responsible for misinformation in their articles?
So the questions about like, what if scholarly papers or journal articles contain misinformation? I think supposedly the peer review process is designed to prevent misinformation going into peer-reviewed publication, but sometimes misinformation does creep into peer-reviewed journals. This is just my personal view. I think, yes, journals should be responsible for misinformation published in their outlets. But I think it's very hard to prevent. Even with reviewers, there's no way that you can verify all the information that's presented, in paper. But, I would say yes, but I think it's very hard to implement. Do you have any thoughts about that, Yuan?
Yeah, I think in academic, there is also a retraction process. So when people found there are flaws in the article, it's retracted and no longer available for public.
Okay. There's another question that says, if an article depends on logical fallacies, does that matter?
These are really interesting. If an article depends on logical fallacies.
Mm-hmm.
Why would an article depend on logical fallacy? I think maybe what this means is that if an article contains logical fallacies, does that matter? Again, I think presumably these kind of fallacies or misinformation should be detected during the peer review process. But I also saw in the chat that like peer review is deeply flawed, and I agree. But it's like, it's like democracy. It's the worst system, but it's the best available, right? So I think peer review is the worst, but it's the best available. And compared to alternatives, like what alternatives do we have? Other than peer review, I think maybe there's things we can do to improve peer review, but it's always gonna be flawed. I think we're always trying our best to kind of optimize the process. But I think the idea about, one thing I do think is important to pay attention to is that we always talk about misinformation, like on social media, these, QAnons, conspiracy theories. In fact, I think maybe it's my personal view, some of the most damaging misinformation coming from scholarly sources, right? So the anti-vaccine, vaccine autism paper by Wakefield, I think, I don't know how many lives it is responsible for. I certainly think that misinformation coming from a seemingly like scientific sources is perhaps most damaging of all. So we need to be really careful when screening these articles.
Okay.
A lot of discussion in the chat. It's kind of hard to follow.
Well, this pretty much sums up our time. Just want to thank everybody for attending today and let you know that you can receive an email with instructions for your MLA or CHES credits for today about 3 days after the event. So you can join us for the next session, and the times will be going on all day and for the next 3 days. So join the National Network of Libraries of Medicine, and remember the hashtag is #HealthMisinfo_NNLM. So please help me in thanking the ladies for doing such a wonderful job. You did a great job of presenting, and we have appreciated it, and we have learned a lot, and we look forward to getting the transcript so we can look at your models a little bit more closely. Thank you so much today.
Thank you.